So, hey you guys, this is Marketa Aligood. I wanted to take a few minutes to go over my comprehensive case study with you guys. Um, I did it on pernicious anemia. Let me pull it up where you can see it. All right, so let's start with patient symptoms and history. So I've got a 65-year-old Caucasian male, and he made an appointment to see his primary care provider. He's been complaining of the feeling of unsteadiness for quite some time. He's experiencing some fatigue and shortness of breath more recently. They did a physical exam and noticed that he's lost a moderate amount of weight since his last visit, which was well over a year ago. He states that it's most likely because of his lack of appetite, but he has been trying to maintain a balanced diet, including plenty of meats and vegetables. Historically, he's not required much medical intervention at all, and he's not actively taking any prescription medications. So, due to the scope of this condition, I wanted to acknowledge all of the possible clinical signs and symptoms because a patient's not going to walk in and list all of these. They're probably going to experience a handful and may not realize that some of those are due to this condition rather than, because they ate something strange. So I'm just going to go ahead and go over all of them. So, like my patient has, you can experience fatigue and shortness of breath, but you can also have dizziness, headache, cold hands and feet, cardiac complications. You can experience nerve damage, like tingling of the hands and feet, muscle weakness, loss in reflexes, that feeling of unsteadiness that my patient has. You can have weakened bones, loss of balance. You could have confusion, dementia, depression, and memory loss. Nausea, vomiting, heartburn, abdominal bloating or gas. There can be constipation or diarrhea. And like my patient has loss of appetite and weight loss, but also glossitis, a smooth, thick red tongue, is another notable feature of the condition. So I decided to go about this the way I see our primary care providers do, which would start with more general labs and then streamline to more detailed ones as they get information. So this PCP started out with a CBC with diff and a C-meta. So if you look at the results for the CBC, you can see that the red blood cell counts decreased. His H&H is almost critical per my facility's parameters. He's got an elevated MCV of 120 femtoliters. You've got an MCH of 40 picograms, which is elevated, and then a normal MCHC. On the C-meta, the most notable thing that's going to be present is that total bili being elevated. So as far as the diff is concerned, the cell count is normal, but that slider view is where you're going to start to notice the features of this condition. So you could see the presence of pancytopenia, hypersegmented neutrophils, oval macrocytes, dacrocytes, schistocytes. You might see microspherocytes, NRBCs, Hal Jolly bodies, basophilic stippling, and Cabot rings. So there's a variety of ways that this can demonstrate, but most predominantly you're going to see those hypersegmented neutrophils, the oval macrocytes, and possibly even some dacryocytes. Okay, so moving on. Based off of the anemia, microcytosis, and those hypersegmented neutrophils that were noted, the provider wants to follow up with some more labs. So there's a retic that was ordered, a folate, B12, and an LDH. So the retic is decreased, so we're not getting a lot of new red cells into circulation, or we're getting less than expected. The folate's normal. The B12 is 157, so it's decreased, and we have an elevated LDH. So with these results, that decreased B12, we need a further workup. So the provider is going to order an OMP, serum MMA, homocysteine, serum gastrin, a Schilling test, bone marrow exam, and an anti-intrinsic factor antibody test. So I decided to cover all of these just for the sake of the assignment, and your average primary care provider most likely isn't going to be ordering all of these labs. They may do a Schilling test and a bone marrow exam, or they may do a serum gastrin and anti-intrinsic factor antibodies. But it's very unlikely that they're going to do all of this. I did this just to say that I acknowledge that these are all features of this condition. So let's look at the bone marrow exam. So the purpose of the bone marrow exam is to confirm megaloblastic anemia. So to do that, you would need to see evidence of megaloblastic appearance in erythroid precursors, and you can see that here. You've got an elevated ME, giant metamyelocytes, and bands are present. Okay, so for the serum MMA, that's elevated. Your homocysteine's elevated. That serum gastrin is also up. The Schilling's test has been abnormal at both stages, so it's indicating that it's pernicious autoimmune. And then that intrinsic factor antibody, it's present, and that confirms what the Schilling test has shown us. The OMP is negative. So moving on to the diagnosis. So all of the preliminary tests lead to the indication that the patient has a B12 deficiency. The bone marrow exam is confirmatory for megaloblastic anemia. That OMP test, that rules out a D-latum infection, which is associated with the B12 deficiency sometimes. And then the presence of the anti-intrinsic factor antibodies, the positive Schilling test, lead the PCP to the conclusion that this patient has pernicious anemia. So, treatment. Just to manage those immediate symptoms of shortness of breath and fatigue, 2 units, and obviously the anemia. 2 units of blood were ordered, and that temporarily relieves the anemia, and they can move on to the long-term care. And that's going to be routine B12 shots. So these are going to be done for the life of the patient, and iron supplements are going to be needed just to help reinforce or help support the cell production that is resulted from that increased B12, just helping move red cells along. Anyways, patient outcome. So the patient experienced a relief of shortness of breath and fatigue following that transfusion, and then 6 to 8 weeks following the initiation of the B12 shots, the patient labs can be recollected and assessed for progress. So this patient's CBC shows that there was a correction of the megaloblastic anemia, and the serum B12 is returned to a more controlled value. The patient experiences a successful recovery, but requires more frequent office visits just to monitor the progress with treatment. And these are my references. Okay.